Hi, I'm Dr. Brian Roadhouse, and I'm a chiropractor. I've been taking care of patients in Tulsa for 25 years. I'm on campus at St. Francis Hospital in the Kelly Medical Building. My address is 6565 South Yale, and my phone number is 481-2770. Today what I want to do is discuss with you on this DVD about chronic neck and back pain. If you have chronic neck and back pain, I really don't have to tell you how it just affects your life. I mean, the longer that you've had it, the more things are involved. If you have children, you can't play with your children, you can't do the activities with your children. Makes it difficult just to get through the day, whether you're working or if it's around the house. It affects every relationship that you have. As a matter of fact, a lot of the patients that we've taken care of and given them their life back, they say that we've saved their marriage. So anyway, this is a debilitating problem, and we're going to go over some things that might give you hope. We take care of things differently than most other chiropractors. So, you know, if you're thinking, well, I've already been to a chiropractor and I didn't get any better. First of all, with neck and low back pain, chiropractic is one of the most effective treatments you can have for this condition. I mean, it's in the research. But what I'm talking to you about today is those patients that have chronic neck and back pain and they're not responding. They didn't respond to traditional chiropractic. They didn't respond to epidural steroid injections. They didn't respond to physical therapy. They're maybe taking pain medications, muscle relaxants, anti-inflammatories, natural remedies, whatever it is, you're not responding. Okay, those are the type of patients that we're looking for and we're talking to on this DVD. Now, what we're going to do is we're going to look at this problem neurologically, because you know, even if you've had chiropractic care before or maybe physical therapy and they said, well, we've loosened the muscles up, you know, everything's moving good, and then the next day your back and neck are tight again and you're still having trouble, you know, for the moment you get up in the morning that you start hurting. These are the type of patients we're talking about, because we look at this neurologically. Let me just show you over here on this chart. Basically what happens is that we're going to be looking at the cerebellum and the brain and how it works. The cerebellum is the most oxygen dependent organ in the body. It's heavily dependent on oxygen. Your brain needs two things to thrive. It needs fuel and activation. Fuel in the form of glucose. Well, most of you get that from your diet. The next thing is glucose. If you're over 30 years old, after 30, we lose 1% the ability to utilize oxygen in the brain after the age of 30. It's called oxidative phosphorylation. And there's other things, such as trauma, stress, whether it's physical stress, mechanical stress, chemical stress, any kind of stress, usually some kind of a stressful activity in your life. And what happens is that the cerebellum is supposed to fire to the brain. This is the nerve impulse, and they're supposed to move at a certain speed. And then what happens is it's supposed to fire down to the brainstem. Now the brainstem is in three parts: the upper mesencephalon, the pons in the middle, and the medulla oblongata. Okay, so when it fires down here, it's supposed to go up to the brainstem. And what it's supposed to do is it's a check and balance system where it's supposed to slow down the upper brainstem, mesencephalon. When you have chronic neck and back pain or dizziness, what happens is that this doesn't work right and it drives down the spinal cord. Okay, when that happens, take for example some of these patients that have chronic neck and back pain. You have the SA node right here, the AV node right here, and it's the electrical system of the heart. And what it does is it sets the beat per minute and also the timing of the heart to work properly. Well, when it drives down the spinal cord here and it's moving too much, it causes one not to work right. So then you can have an irregular heartbeat, or you can have tachycardia, where you know your heart is racing and it feels like your heart's going to come out of your chest. Same thing can happen down here, where it drives down here and it affects the colon, where it can affect, you know, your colon and your digestive system. So basically what we need to do is we need to find out if this is affecting you. The cerebellum controls your coordination, balance, and a really important thing in the patients that have chronic neck and low back pain is it controls all the postural muscles of your spine from the skull down to the tailbone. So let's say that you've tried physical therapy, you've had a chiropractor work on you before, and you got a good treatment, or it stretched out and you tightened up the next day and it doesn't seem to hold. It could be that your cerebellum is the cause of this. It could be that it's all in your brain. So what we want to do is we want to wake your brain up and get it working right again. So what we do is we do tests on this to figure out if your brain's not working right. Okay, and if it isn't, then we do a lot of different things, you know, to help. How are we different? How are we going to take care of patients that have this problem right here? Well, first of all, remember I said that the cerebellum is the most oxygen-dependent organ in the body. So we're going to get these patients on oxygen. Not pure oxygen, because that's toxic to the brain, but an oxygen concentrator. And what it does is it starts to wake the brain up by giving the oxygen that you need. Now, we have ways to test for this. We have a couple of different ways, but we test for oxygen saturation rate, and 90 and above is very good for cardiac patients. In other words, normal heart health. But for normal neurological brain, we need 99 to 100. And a lot of the patients that have the chronic neck and back pain, we're checking them, and they're like in 87 or 88. That's not even good for cardiac health. So anyway, we get our patients on oxygen, and it wakes the brain up. Then what we do is we might do some auricular therapy, which is like acupuncture for the ear, and we stimulate different points here. And what it does is it stimulates right down here to the lower brain stem to stimulate it, to speed up its frequency of firing, to slow down the mesencephalon. Okay? Next thing we do on these patients is we do unilateral adjustments. We only treat them on the side where the cerebellum is not working. You have a cerebellum on the left and on the right. Let's say we do the test on you, we find that your cerebellum on the right is not working right. What we do then is we use an adjusting instrument to stimulate the little neurons and nerve receptors on this side of the neck. And usually on patients like this, we'll use an adjusting instrument, or we might use the standard gentle chiropractic treatments, but we only do it on one side so we can stimulate these neurons to fire to the cerebellum to wake it up and start this frequency of firing, getting it back the way that it should be. The other thing that we can do is there's a certain part of the brain that we find on the exam that isn't firing properly. So we might do auditory stim. In other words, we put it in one ear to stimulate the brain, and it might be something like listening to nature sounds, listening to Mozart. Certain beat per minute stimulate different parts of the brain. We might do some visual stim. That's stimulating the eyes, because the eye goes right to the brain through the third cranial nerve. The second cranial nerve is ocular. For the eye, the third cranial is ocular motor that constricts the pupil. So some of these patients have sensitivity to light at certain times. It's because that's not working right. So we might give them visual stim, where we have them look at pictures of people that they recognize. That stimulates one part of the brain. We might have them look at pictures of complete strangers. That stimulates another part of the brain to wake your brain up and make this loop of the frequency of firing work the way it's supposed to. Another thing that we do on these patients is we do spinal decompression. Spinal decompression slowly stretches the muscles like this, and when that does that over a period of time, it stimulates the cerebellum to start working right. But the other thing it does is a lot of these patients that have chronic neck and back pain, when these muscles are staying in a state of tightness and spasm, and if they stay like that for a period of time, what happens is they start pulling vertebra out of place, start putting pressure on the nerve. It affects the ligaments, and so then you can have disc injury, bulging herniated disc, or you can get even disc degeneration. And the spinal decompression works fantastic on all that, because what it does is it separates it. It takes the pressure off the nerve by going like that, but also what it does is it creates a negative pressure inside the disc. And so we've even had patients that have had back surgery, and they removed part of the disc that was bulging out. But there's a part of the disc in the middle called the nucleus pulposus. It's like a hard super ball that you've probably seen your kids or you played with as a kid. You bounce it and it goes sky high like that. And the disc is filled with jelly. Okay, so when that nucleus right here in the middle moves back, that causes the disc to bulge or herniate. So typically what they do is they go and trim that disc out of it, but they don't address the nucleus pulposus. Okay, that's what the spinal decompression does, is it opens that up, takes the pressure off, creates a negative pressure inside the disc and inside the joint, and allows that nucleus to come back. We've had fantastic results with that. Another thing that we might do on these patients is we might do interactive metronome, which is a computer brain-based rehab assessment and training program, and it works really fantastic to treat balance disorders, MS, chronic pain syndromes, whether it's neck and back, migraines, numbness, restless leg, reflex sympathetic dystrophy, ADD, ADHD. Another thing that we might do is a warm caloric. And all these treatments that we're doing, you know, as the patient comes in, we're evaluating them. We're trying a treatment on them to see if that stimulates this part of the brain. Then we retest them and find out, okay, this part of the brain is working better. Now we got to work on this part here. So we might do a warm caloric. A warm caloric is we take water and we put it in an irrigation syringe and we put it in the ear right here. And it's about 105 degrees, which isn't real hot. It won't burn you because your body's 98.6. It's just a couple degrees more. But inside the semicircular canals, there's a substance called endolymph. Endolymph is a gel. And when you heat up a gel, like, you know, Jell-O or anything like that, it liquefies. And when that liquefies, when the warm water goes in and hits the eardrum, stimulates the semicircular canal, it causes the gel to liquefy, and then what happens is it stimulates the kinocilia and the stereocilia, which are the small little hair-like organs inside, you know, the canals and in the ear. And what that does is that stimulates the vestibular nerve to go to the cerebellum and stimulate the cerebellum to start firing properly. This is really important with patients that have chronic pain, fibromyalgia, and any kind of dizziness or balance disorder. Because, you know, dizziness and balance disorder can be caused by, you know, like an ear infection or something like that. We're not talking about that. We're not talking something, you know, that will last a week or two. We're talking about people that all of a sudden they have this balance disorder, dizziness when they get up, when they move, you know, in different positions. You know, they're scared to walk. That's what we're talking about, and this treatment helps with that. The other thing that we might do is there's certain parts of the brain that certain smells stimulate. So what we do is we have you smell certain scents that you know and you're aware of. You've probably smelled them throughout your life, and we have you smell those. And we find that the patients that one part of the brain is not firing properly, then what happens is that we have you smell them. And if you can't smell on a certain side, on that side there, that means the brain is not firing properly. And so we'll have you, you know, smell these certain smells to stimulate that part of the brain to work again. We also do, as the patients get better, we do an upper body ergonometer. And that's basically a bicycle for your arms. And what happens is that when you do that, the movement of it, there's so many nerve fibers in your neck. And when you move your arms like that, that stimulates the little nerve receptors in the neck to stimulate the cerebellum to you know, start working that loop again to make everything work right. Another thing that we might do is that we might do exercise while on oxygen therapy, because we talked about, you know, how the cerebellum is the most dependent organ as far as oxygen goes. And to wake the brain up, we have you do oxygen. Well, one thing that works really good is doing the upper body ergonometer while you're on oxygen, and it just lights up the brain and really stimulates it, you know, to wake your brain up. And so what happens is, as we work on these these different therapies to get your brain working right, then all of a sudden the loop works, and then the muscles relax, your balance is better, your coordination is better, and with the spinal decompression, you know, you really improve. So anyway, if you have any kind of chronic neck or low back pain, you've been to a lot of different doctors. We're getting people better that no one else is getting better, and we're getting your life back. So if you're interested, call the office and we can do the screening examination on you. It's a brain screening examination to see if it's not firing properly. If your brain is not firing properly, then we're going to be able to help you. So if you want to know if we can help, give us a call, and we'll get you in for the consultation and the screening exam, and we'll see if we can help you. Thank you.